Hello everyone. Today I'll be explaining in brief about the calculation of child dosage and the most commonly used drugs in children and their dosages. Okay. So the successful outcome of any drug therapy depends on these factors, that how the drug, the pathogen and the host, they interact. Okay, so unlike in adults, children, they are constantly growing and developing. So there is, quite a number of differences which exist, be it body surface area, be it any of the vital organs like hepatic and renal function, depending on the age. So it is because of that we need to study appropriate dosage for children, how to calculate it, okay, for various drugs. So the physiological differences in pediatric patients are basically categorized into these. Uh, the differences may lie in absorption, in the distribution, or in the metabolism and in excretion. Okay, so absorption depends on a lot of factors like the surface area which is available, the gastric and the duodenal pH, then the gastric emptying time, the size of the bile salt pool, or bacterial colonization of the gastrointestinal tract, presence and extent of underlying disease which influence the absorption of the drug. So these are all the factors which affect the absorption. Then comes distribution. So distribution depends on a lot of factors. They influence the volume of distribution. Okay, so these are the size of various body parts, then the protein binding property of the drug, and hemodynamic factors, then local blood flow and membrane permeability. Okay. Metabolism also is different. It varies from, different in different ages, and also there is some individual variability also. Okay, inter-individual variability. So most of the metabolism takes place in liver, and liver cells, they carry enzymatic reactions which are broadly classified into two types: phase 1, phase 2. So these include oxidation, reduction, hydrolysis, hydroxylation, etc., and phase 2, conjugation with glycine, glucuronide and sulfate for enhancement of drug excretion. Okay, and then excretion, the amount of the drug which is filtered by the glomeruli, it depends upon the glomerular function, the renal blood flow, the drug protein binding. So renal tubular function, it matures in children at 30 weeks of age, and glomerular rate between 3 to 5 months of age. So thus development and maturation of the glomerular function filtration rate is very important in determination of the appropriate drug dosage. Okay, then these are certain other things which we have to consider. In neonates, the blood brain barrier is immature, so the drug might be delivered to the brain. Then lower plasma levels of albumin causes less protein binding, so there is increased chances of, you know toxicity. Then higher body water content leads to greater volume of distribution of water soluble drugs, and thus increased duration of action of those drugs. Then pharmacodynamically inactive tissues like muscle and adipose tissue, they are, since they are inactive, so less drug uptake and higher chances of, plasma concentrations in children. Then hepatic clearance of drug in children who are 2 to 6 year old is less, so larger hepatic mass is there relative to the body size or body weight, so higher doses are required sometimes in shorter intervals comparatively. And renal function and excretion of drugs is reduced. So all these factors are to be considered while deciding the dose. Okay, so adjustment of dosages in pediatric patients. In general, pediatric patients, they cannot be given adult dosage, of course. The primary reason is there is a difference in the body size. Then several rules they exist to compute or to calculate the dosage of a drug for a child. The most common are the Clark's rule, the Young's formula, and several others like Dilling's rule and Fried's formula. Okay, so current dosage recommendation usually is based on the basal metabolism of the child. So these are certain very common formula which are asked. These are generally directly asked as a MCQ question in exams. So dose calculation based on age, that is age of the child. So Young's rule tells that a child's dose is equal to age of the child in years divided by age of child in year plus 12 multiplied by adult dose. Okay, then Dilling's rule, it says child's dose is equal to age of the child in year divided by 20 multiplied by adult dose. And Freud's rule says that child's dose is equal to age of the child in months, that is it is usually for the infants, okay, divided by 150 multiplied by adult dose. Then we can calculate dose based on the body weight of the child. So Clark's rule, it says child's dose is equal to body weight in pounds divided by 150 multiplied by adult dose, and also if the body weight is in kg, then divided by 70 and multiply it by the adult dose. So we get the dosage. Based on body surface area, the child's dose in milligram is equal to the child's body surface area in meter square divided by the average adult body surface area, which usually is around 1.73 meter square, multiplied by average adult dose. Okay. So now let's see the commonly used drugs in dentistry and their dosages. Okay. So antibiotics, the most common one which is used is amoxicillin. Okay, it's available as Novamox or Amoxil, and it is used to fight a wide range of infections. Okay, and there are certain side effects also like gastrointestinal upset, diarrhea, etc. And it is also used along with clavulinate. Amoxicillin and clavulinate combination is very commonly used in dentistry. The brand name is Augmentin. Okay, so the pediatric dosages for children up to 10 years of age, more than 40 kgs, 125 to 250 milligram can be given 8 hourly. And children up to 10 years who are less than 40 kgs, 20 to 40 milligram per kg daily in divided doses can be given 8 hourly, or 25 to 45 milligram per kg daily in divided doses every 12 hours. And the maximum dose for children is 2 grams per day, not more than that. And in infants who are less than 3 months old, maximum of 30 milligram per kg can be given in divided doses. And the available forms are tablets, chewable tablets 125 milligram, then it's available in capsule 250 milligram, 500 milligram, and oral suspension of 125 milligram per 5 ml and 250 milligram per 5 ml. Okay. Then for the combination of moxicillin and clavulanic acid, it is always 25 milligram per kg per day to 45 milligram per kg per day every 12 hours, or 20 milligram per kg per day every 8 hours. Okay, so the maximum dosage for children less than 40 kg, 1000 to 2800 milligram amoxicillin and 143 to 400 milligram of clavulanic acid can be given. This is the maximum dosage. And the available forms are, it's available in tablet form 375 milligram, for adults 625 milligram 1000 mg tablets are also there, and oral suspension of 228.5 milligram per 5 ml. Okay, so we have to use lowest dose of clavulinate when it is used along with amoxicillin to avoid the gastrointestinal adverse effects. Then comes cephalosporins. So cephalosporins, the commonly used ones are cefalexin and cefadroxil, which are both the first generation cephalosporins. Okay, so they fight against most of the gram positive infections and some gram negative bacteria as well. Again, the side effects remain same: gastrointestinal upset, diarrhea, nausea. And then there is cefixim, which is a third generation cephalosporin, and these are the trade names, and they are also have an improved coverage of gram negative organisms. Then again, the side effects include gastrointestinal upset, diarrhea, etc. Let's see the doses. Okay, so cephalexin, which is a first generation cephalosporin, the pediatric dosage is always 25 to 100 milligram per kg per day every 6 to 8 hours. And the available forms are, it is available as a tablet, as a chewable tablet as well, 125 milligram, 250 milligram, 500 milligram. It's also available as a capsule, 250 milligram, 500 and 750. And oral suspension, 125 milligram per 5 ml and 250 milligram per 5 ml. Okay, so for very young children we prescribe this one, and for children who are slightly older, 250 milligram per 5 ml. Cefadroxil pediatric dosages 30 to 40 milligram per kg per day in two divided doses, and it's also available as a tablet, as a capsule and oral suspension. Okay. Then comes cefixime. Cefixime should be given 8 milligram per kg per day in two divided doses for children who are less than 50 kgs or less than 12 years. And the available forms are, it's available as a tablet, 400 mg, chewable tablet of 100 mg and 200 mg, and oral suspension, 100 mg per 5 ml, 200 mg per 5 ml, and also 500 mg per 5 ml. Okay. Then comes another important class of drugs, metronidazole. Metronidazole available as there are many brand names. One of it is Flagyl, and commonly it is used for infections which are anaerobic and for mixed infections. Side effect is discolored urine, nausea, headache, etc. Alcohol is contraindicated, and the pediatric dose, let's see, it is 30 milligram per kg per day, and it is always in three divided doses. Okay, age 7 to 10 years, 300 milligram in three divided doses can be given, and for smaller children 3 to 7 years, 200 milligram in three divided doses, and children who are even younger, 1 to 3 years, 150 milligram in three divided doses. So maximum dosage for children for metronidazole is 2 grams per day, and the available forms are, it's available as a tablet, 200 milligram, 250, 400 and 500, and also as infusion and oral suspension. Okay, 500 milligram per 5 ml and oral suspension as 200 milligram per 5 ml. Okay. Then comes doxycycline. The forms of this particular drug are suspension, tablet, capsule, injectable, all forms. Okay, so usual oral dosage for necrotizing ulcerative gingivitis uh, is that children less than 8 years who weigh less than 45 kilogram, 2.2 milligram per kg every 12 hours on day 1, and then 2.2 milligram per kg once every day. Okay, for severe infections it should be continued 2.2 milligram per kg every 12 hours until the infection starts resolving. Okay, and in children who are more than 8 years who weigh more than 45 kg, 100 mg every 12 hours on day 1, and then 100 mg once a day should be given, and for severe infections 100 mg every 12 hours until the infection resolves. Okay, so the only disadvantage of this particular drug is that if it is given during the time the tooth formation is taking place, it can cause permanent tooth discoloration or enamel hypoplasia. Then comes clindamycin. It is also available as suspension, capsule and injectable. So children who are in children, the doses are 8 to 20 milligram per kg per day in 3 to 4 divided doses, or 8 to 25 milligram per kg per day in 3 to 4 divided doses. Okay, so in endocarditis prophylaxis also it is given as 20 milligram per kg, maximum 600 mg, 30 to 60 minutes before the procedure. Then comes another drug, erythromycin. It is active against all these uh, organisms, Streptococcus, Staphylococcus, and diphtheria. And the dose is 20 to 40 milligram per kg, and in 2 to 4 divided doses. Gram-negative organisms are usually unaffected by erythromycin. Then comes azithromycin. It's an option for patients who are allergic to penicillin or cephalosporin, and the forms of Azithromycin available are tablet, capsule, suspension, injectable. Children who are more than 6 months up to 16 years, 5 to 12 milligram per kg, one time a day. Maximum 500 milligram can be given in a day, or 30 milligram per kg as a single dose can be given. And in children who are more than 16 years and adults, 250 to 600 milligram one time a day, or 1 to 2 gram as a single dose can be given. Okay, and then comes antibiotic prophylaxis. Okay, so for antibiotic prophylaxis, this is a specific antibiotic regime which is revised by the American Heart Association in 2014. So the standard is amoxicillin should be given 50 milligram per kg body weight. Orally, it can be given 1 hour before the procedure. But if oral intake is not possible, then ampicillin can be given 50 milligram per kg body weight, IM or IV, 30 minutes before the procedure. But in case the patient is allergic to penicillin, then in those cases, clindamycin can be given 20 milligram per kg body weight, maximum 600 mg. We just read orally 1 hour before the procedure, or cephalexin cefadroxil 50 milligram per kg body weight orally 1 hour before the procedure, or azithromycin or clarithromycin 15 milligram per kg body weight orally 1 hour before the procedure. And if they are allergic to penicillin, but uh, also the oral intake is not possible, in such cases clindamycin can be given IV 15 mg. The dose remains same, 15 mg per kg body weight, but IV 1 hour before the procedure, or cefazolin 25 milligram per kg body weight, IM or IV 30 minutes before the procedure. Okay. This is just in brief. This is a summary of what all we read just now. The dosages of the commonly used drugs: amoxicillin 50 milligram per kg per day, 8 or 12 hourly, and the dosage form in which it is available. Okay, so it is for all the drugs. You can brush up just by looking at this table. Okay, so all the drugs just now what we discussed is summarized in this table. Then let's jump on to analgesics. Okay, so the most commonly used is acetaminophen, which is used in mild to moderate pain, and the form in which it is used is either liquid or tablet or oral disintegrating tablet, or as a suppository or injectable. And children who are less than 12 years, 10 to 15 milligram per kg per dose every 4 to 6 hours as required. And these are certain trade names which are available for this particular drug. Okay, the usual oral dosage: children who are less than equal to 12 years, zero point 0.5 to 1 milligram codeine per kg per dose every 4 to 6 hours. Okay, and 10 to 15 milligram acetaminophen per kg per dose every 4 to 6 hours can be given. Okay, and children who are 3 to 6 years, 5 ml elixir at least 3 to 4 times a day. Children who are 7 to 12 years, 10 ml can be given 3 to 4 times a day, and more than 12 years, 15 ml can be given every 4 hours. But usually in children who are above 6, tablet form is preferred over the elixir. Okay, so morphine oral prolonged release can be given 200 to 800 micrograms every 12 hours, and hydromorphone can be given 30 to 80 microgram per kg body weight every 3 to 4 hours, and oxycodone is given 125 to 200 microgram per kg every 4 hours. Oxycodone prolonged release can be given 5 milligram every 12 hours, and hydrocodone 100 to 200 microgram per kg every 4 hours. Codeine can be given 0.5 to 1 milligram per kg every 4 hours, and tramadol can be given 1 to 2 milligram per kg every 6 hours. Maximum dose is 100 milligram per day. Okay. Then comes another most commonly used analgesic, which is ibuprofen. Okay, so it can be given in liquid form, tablet or injectable. Children who are less than 12 years, 4 to 10 milligram per kg per dose every 6 to 8 hours as needed. Okay, maximum 40 mg per kg per 24 hours. And children who are more than 12 years, 200 milligram every 4 to 6 hours as needed. Okay, maximum 1.2 grams per day. And these are certain trade names which are available. Okay, then comes naproxen. It is also available in suspension and tablet form. Children more than 2 years up to 12 years, 5 to 7 milligram per kg every 8 to 12 hours as required. And children who are more than equal to 12 years, 200 milligram every 8 to 12 hours as needed. It may take 400 milligram of initial dose and maximum dose of 600 milligram every day per day. Then comes antiviral drugs. Okay, so the most commonly used ones, systemic antiviral agents are these are used for the treatment of primary herpetic gingival stomatitis or any kind of herpetic infections. Acyclovir is used in suspension form, 200 milligram per 5 ml, or tablet 400 milligram, 800 milligram, and capsule of 200 milligram, also injectable 50 milligram per ml. And children 15 milligram per kg 5 times a day for 7 days, maximum 200 milligram per day. And adolescent and adults, and for adolescents and adults 400 milligram 3 to 5 times per day for 10 days or until the clinical symptoms have subsided. Okay, then famciclovir tablet 125 milligram, 250 milligram, and 500 milligrams are available for children. Safety and efficacy has not been established, so it's used in adolescents. Okay, so only in adolescents 1500 milligram as a single dose can be given at the first sign and symptom of infection. And valacyclovir, it's also available in 500 milligram and 1 gram tablets. So children who are greater than 12 years and adults can be used 2 gram in 2 divided doses 12 hours apart. Okay, then comes the topical agents. In this there is docosanol, which is a type of alcohol. For it's available in cream form, 10%. Children more than 12 years and adults, you can apply a thin layer on lesion 5 times a day up to 10 days. Acyclovir is also available in cream form, 5%. So children who are more than 12 years and adults, apply a thin layer on the lesion 5 times a day for 4 days. And acyclovir with hydrocortisone is also used in cream form, 5% acyclovir and 1% hydrocortisone. It is applied a thin layer on the lesion 5 times a day for 5 days. But all this is in children who are older than 12 years. Okay, not in younger children. Then comes antifungal drugs. So antifungal drugs, the systemic antifungal agents which are used in oral candidiasis. So fluconazole is an important one. The forms which are in which it is available, suspension 10 milligram per ml, 40 milligram per ml, and tablet of 50 mg, 100 mg, 150, 200, and also injectable 200 milligram and 400 milligram. Okay, in neonates, single dose of 6 milligram per kg on day 1, and then it is decreased to 3 milligram per kg once a day for 7 to 14 days. And in adolescent and adults, single dose of 200 milligram on day 1, and then it is to be decreased to 100 milligram once a day for 14 days. Okay, then come another drug, ketoconazole. It's a water soluble drug. Okay, so it's available in tablet form, 200 milligram. Children more than 2 years, 3.3 to 6.6 milligram per kg once a day can be given until the infection has resolved. Then there are certain topical agents for angular cheilitis. These are clotrimazole. It's available in cream form, 1% cream, and all ages. It can be applied a thin layer to the corners of the mouth 4 times a day. Okay, until complete healing takes place. Then miconazole nitrate. It is a broad spectrum antifungal agent, and it's applied as a cream or ointment, 2%. And children more than 2 years and adults, you can apply thin layer on the corners of the mouth 4 times a day for 14 days until complete healing takes place. Okay, then nystatin, it's available as an ointment or cream, and the usual dosages: apply a thin layer 4 times a day for 14 days, and it's also available in combination with triamcinolone acetonide, and that is also applied 4 times a day. Then topical or transmucosal agents for oral candidiasis. These are clotrimazole. It is available as a lozenges, 10 milligram, and it's not used in patients less than 3 years of age, and dissolves. So you can give 4 to 5 times a day for 14 days, and treatment may extend beyond the clinical resolution. Then miconazole, it's available in tablet form. The usual dosage in adolescents and adults: 1 tablet per day for 14 days. Then nystatin suspension. Here in neonates, this 1 ml of solution is given 4 times, which contains 1 lakh units 4 times a day. Half of the dose is placed in each side of the mouth, and infants 4 times a day, half of the dose is placed in each side of the mouth. So this is based on the age. Neonates, it is lesser in dose, 1 lakh, and then in infants it is increased up to 2 lakhs, and in children and adults they have to swish around 4 lakh to 6 lakh units, that is 4 to 6 ml 4 times a day. Okay, and then they're supposed to swallow it. Okay, so this was in brief about the various most commonly used drugs in dentistry and their pediatric dosages. So you can go through this video briefly to understand what is the dosage or how to calculate the dose in children for various drugs. Not many questions have been asked from this topic, but still I have seen that so far whatever questions were there, they were direct questions on either the calculation formula. So you must thoroughly read all the formula. They might ask by the name of that particular formula of calculation of the drug dosage, and then you have to remember few important ones and their dosages in children. Okay, so if there is any query, any doubts, feel free to ask. Okay, thank you so much.